Good morning, good evening, everyone. Welcome to the UN Global Compact Academy session on how business can deliver health resilient climate action. My name is Heidi Huusko, and I'm a senior manager at the UN Global Compact. I lead the environment and climate team, and I am also a senior advisor and a co-founder of the Science Based Targets initiative. We're very happy to have you here today with us. Welcome everyone, and we can move to the next slide, giving an overview of today's Academy session. So we can take a look at the agenda for today. Today we will discuss why addressing climate change is the greatest health opportunity of the 21st century. And at the UN Global Compact, we have launched a brief that gives an overview of 5 key health and climate topics. And those are air pollution, nature and biodiversity, food systems, water resilience, and just transition. And today we will dive into a few of these examples. So the agenda for today's session is that sorry, we can just move back there. I'll give an introduction to the topic. We will also learn why climate change is a health crisis. We're happy to be joined by AstraZeneca and Essity, as well as Forum for the Future, and we will listen to some case studies for action. Then we have our colleague from ILO who will speak about healthy just transition, and then there is also an opportunity for a Q&A. So during this presentation, I really encourage you all to use the Q&A function that you see at the very bottom of the page. So feel free to go in there, chat your question. We will be also answering those in writing, and we will also be pulling a few of these to the audience. And thank you everyone also for sending questions in advance to us as well. So we can move to the next slide now. At the UN Global Compact and earlier on in the year, we came out with this empowering business narrative and a call for health resilient climate action. This is a set of recommendations that gives the perspective of integrated climate and health action. And the idea is here that it's a very short brief. It orientates companies towards various initiatives and actions in 5 climate and health focus areas. So today's session is built around the brief, and for instance, our speakers were part of producing this brief together with us, and we worked over a number of months bringing this together out with companies and with our strategic partners, including the WHO. So coming out from today's webinar, we are hoping that you have learned more about the climate and nature health nexus, that you have a few examples of health risks linked to climate and nature and how it's already impacting business. You have also heard from experts and business leaders on how to ensure we view health resilience as a business opportunity, and then also examples of actions that business can take to deliver these co-benefits. So let me see if we have our first speaker already joined, or if we should move on to the next segment. All right, so let's wait for Dr. Maria Neiro to join, and she will come in shortly. I will then start with walking through the business case for taking integrated climate health action. So we can move into the next slide, and I wanted to share a preview of a upcoming study that we are doing together with Accenture. This will be launched just ahead of the COP, but I wanted to give you a a little taste of what we see in that study. And across all regions of the globe, CEOs are recognizing the negative health impacts linked to climate change. And they are seeing these negative impacts on the workforce as one of the top 3 risks, climate risks and health and nature risks all over for the company. So climate and health is really moving up to the top of the agenda also at CEO level. And business has a crucial role to play in tackling climate change and health resilience. As you all know, it's our moral imperative, and it's aligned with corporate responsibility to respect human rights, as well as an opportunity for business as climate change continues to increase health costs and business risks around the world. As a matter of fact, the health costs associated with climate change, including conditions linked to air pollution, undernutrition, extreme weather events, and infectious diseases, are immense. We are talking about 2 billion to 4 billion in health costs per year by 2030, according to recent figures from the WHO. By using health as a leading indicator of progress for environmental and climate action, companies can find the business case for action much more compelling. And we've seen that this also helps to uncover cost saving and risk reductions that would actually otherwise not been seen. So meeting the goals of the Paris Agreement really gives business across all sectors these opportunities to deliver the co-benefits on human and planetary health, but also on business performance. And this is a way that we've also seen that companies help reduce their cost as well as regulatory risks, while aligning with many consumer trends that are actually also upcoming. At the same time, of course, we see the benefits of companies can help save lives, reduce absenteeism, increase productivity, and retain their employees. And we will shortly hear a few of those examples. And finally, I also wanted to share that achieving the Paris Agreement would deliver health benefits worth 1.5 to 2.5 times the cost of mitigation efforts. So we can move to the next slide. At the UN Global Compact, we have focused to deliver climate health co-benefits around these 5 key areas, which are air pollution, nature and biodiversity, food systems, water resilience, and a just transition. And for each of these areas, the business case is pretty clear, but let me give you a couple of figures just for illustrative matters. So take, for instance, air pollution. Meeting the goal of the Paris Agreement through a large and rapid drop in greenhouse gas emissions and reduced air pollution could bring 54.1 trillion in health benefits. The health gains resulting from shifting away from coal, oil, and natural gas to renewable energy would really repay the cost of investments twice over. And then giving an example on food systems, according to the Lancet, food is the single strongest lever to optimize human health and environmental sustainability on Earth. So as an example, a planetary health diet, less reliant on animal-based agriculture, could prevent 11 million deaths annually. And then finally, as an example on water, according to the World Health Organization, every dollar invested in clean water and sanitation delivers $5.50 in health co-benefits. So it's the more productivity and fewer premature deaths. I wanted to give you those figures before we move over to our company examples. And let me check in with my colleagues. Yes, so let's go into our first case study. And I'm very pleased to introduce for you Professor Jason Snape. He's the Global Head of Environmental Protection and AstraZeneca. Jason, you have been working with these topics for a while now, and we're glad to hear from you a little bit more about how you and your team at AstraZeneca is tackling these topics. So I'll hand over to you, Jason.
Okay, thanks very much. And it's an absolute pleasure to be here. As we all know, our world's facing huge sustainability challenges, and we need strong leadership, coordinated and collective action at scale from all, whether or not we're in the public, private or the philanthropic sector. 4 of the challenges we face, obviously, we've got climate crisis at the moment. That poses that risk to public health. We're seeing rising global temperatures, accelerating respiratory and cardiovascular disease, food insecurity and changes in waterborne diseases, and increasing allergens as well as mental health impacts. And from an air pollution perspective, the WHO estimates that we're going to see about 14 million deaths per annum as a result of living or working in an unhealthy environment, with 8 million of those coming from air pollution alone. We also know, with regards to access to healthcare across the world, many people, especially though in low to middle income countries, face barriers in accessing medical treatment and healthcare for many reasons. And that can include the lack of insurance, inability to pay, but living in medically underserved communities. And according to the WHO, there's about 2 billion people worldwide that have no access to essential medicines, effectively shutting them off from the benefits and advances in modern science and medicine. And then we need to build a more resilient future. It's got to be just as well. So it's placing social justice at the heart of our recovery and prioritizing diversity, equity, and inclusion in everything that we do. And then we've got to think about our economic recovery. Across the globe, we're faced with unprecedented economic downturn alongside a public health emergency. And as we're looking ahead to the post-pandemic world, we've got to consider how we can ensure an inclusive recovery in all regions and all countries to mitigate the long-term damage to economies' growth and resilience, and particularly against that backdrop of climate change. Next slide, please. So within AstraZeneca, we're focusing on 4 key initiatives. These are linked to our strategic priorities, and they're also our commitment to achieving our sustainable development goals. In the first instance, we're looking at decarbonising healthcare. So this includes our commitments on Ambition Zero Carbon and our greenhouse gas reduction, and I'll talk a little bit more about that in a moment. It also includes looking along our broader value chain. So we invest $12 billion per annum in goods and services that we're procuring. So we're actually using our voice and amplifying that voice and our sustainable ambitions more broadly in terms of that supply chain, but also the stewardship that we actually bring to the products, the goods and services that we provide. And then we've got health equity. So it's making sure that we're investing in health systems and health system resilience and improving affordability and accessibility, not just to medicines, but actually to healthcare itself. And then it's around building trust. So it's about how we do business, how we engage, and ensuring that we have an ethical business culture. And actually we respect human rights in all the regions in which we operate. And if I focus just on the final slide about the work that we're doing on decarbonising healthcare, but also engagement with our broader supply chain and value chain, we launched Ambition Zero Carbon last year at the World Economic Forum. And that was an aim where we accelerated our decarbonisation agenda by more than a decade. We also looked to invest $1 billion to actually deliver on these commitments. And that was to eliminate our own greenhouse gas emissions from our sites and fleet by 2025, but to become carbon negative across the entire value chain by 2030. So it was removing our emissions largely from the planet. So to meet those 2025 goals for our Scope 1 and Scope 2 reductions, we're looking to double our energy productivity, so to decouple the growth of our business from our natural resource consumption, transition over to 100% renewable energy, both for power and heat, and we're already at 99% imported renewable power and 89% renewable power overall within AstraZeneca. Obviously, we have to sell medicines, and we've got 17,000 vehicles actually in our field force selling medicines globally. So we're looking to transition those 17,000 vehicles over to fully electric vehicles, again, mitigating those emissions from the tailpipe and the air pollution that they contribute towards actually in the cities. And there, when we make some of our medicines, but where we've got refrigerants and coolants, it's making sure that we eliminate those F gases from our sites. If I'm looking at that more longer term goal out to 2030, where we're looking to be carbon negative across the entire value chain, one of our biggest emissions is actually the patient use of our respiratory products. So we have a vicious circle there that actually air pollution is actually driving respiratory disease, and then we're taking medicines that actually contribute to global warming and poor air quality. So what we're looking to do is transition our respiratory devices to next generation devices that have near zero climate impact propellants. And this is a transition that we've had to do before. So in the past, we've had CFCs that have actually caused ozone depletion in many of these devices. We've had to transition over to HFAs and HFCs, which actually have a high global warming potential. And now we've got two propellants actually with a near zero climate impact potential, where we're moving that transition over the next 5 years to launch, and then we will transition that portfolio out to 2030. We also have to innovate differently and explore how to design in sustainability across our product life cycles and embed net zero actually into our cost of goods. So we're changing our business models across our value chain. And then a lot of our emissions actually sit with our suppliers. So it's working with them to make sure they've got access to renewable heat and power. So we're looking at supplier power purchase agreements, but it's also engagement to make sure that they sign up to the net zero targets under the Paris Agreement. And then alongside these commitments, we're investing in nature as well. So we're looking to plant and maintain 50 million trees as part of AZ Forest, but actually we're going to have a bigger footprint maybe to compensate out to 2030. So again, it's investing in nature and nature-based solutions and many of the co-benefits that brings to societies and communities. So that's a very, very brief overview in terms of some of the work and some of the commitments that we're doing, but it's actually not just thinking about AstraZeneca, it's thinking about our broader supply chain, but actually more recently, it's starting to think about how can we decarbonize healthcare more generally. So actually work with the healthcare sector itself, challenge the existing standards of care, and look at the potential for disease prevention, early diagnosis, early clinical intervention to actually reduce the carbon footprint of existing care pathways, because people having to go into hospitals requiring surgery or requiring dialysis have a much greater carbon footprint than healthy members of society. So it's starting to see investment in health, investment in disease prevention actually can have better outcomes for people, for communities and economies, but also for the environment. And I'll stop there. Thank you very much.
Thank you, Jason, for talking about the connection between climate, health, and particularly through the lens of air pollution. And also really wanted to recognize AstraZeneca's work, including with the Science Based Targets Initiative and the deep decarbonization that AstraZeneca is doing, which is vital here in this discussion. So thank you for that. And as a next example, I'm happy to present for you Anna Brodowski. You are the Vice President of Public Affairs at Essity, and you will talk through a little bit more about how your company is working on the nexus of health and nature.
Thank you so much, Heidi. And good afternoon, everyone, and thank you very much for the invitation. Well, exactly, like I wanted just to first say that Essity is a hygiene and health, it's a global hygiene and health company, and we actually work very much in the area of health. So working and taking actions for people, that lies at the heart of what we're doing. And we're working very much with hand hygiene and menstrual hygiene, but also in the area of health for incontinence care and also wound care, just to mention a few. Taking action for people is at the heart of what we do, of course, but we also have a strong and long-term legacy of also actions in environment and sustainable actions. And like many other companies have done, looking at the UN Sustainable Development Goals, they are all, of course, interrelated and extremely important. We have chosen 6 of them that are specifically close to our heart, but equally close to where we can deliver and where we can actually show results. And these are the ones in the area of health and hygiene at the upper bar here. And then in the second area is, of course, in the area of climate and nature. And unfortunately, we've seen in the last few years now, and I think the report from the UN this summer, that we are not really seeing progress on these overall. And of course, we all have to jointly step up actions here, both on the health and people side of this, but of course also on the environmental side. And I think that shows us that when we look at taking actions, we need to look at this in the broader sustainability agenda perspective. And that's why I think this specific seminar is so relevant, to actually see where are the interrelations. COVID pandemic obviously has shown us that in the new normal, we have to accelerate actions on hygiene and on health. But equally, we have the climate emergency. And Essity, as many other actors, are taking actions here, of course. We have taken actions concretely throughout our business and also our value chain, as we heard from AstraZeneca. We signed on to the science-based target about 4 years ago, and now also to the business ambition for 1.5 degree and the net zero targets to 2050. So there's a lot to do there, but we also see we can't do this alone. We need to work with policymakers, we need to work with different stakeholders to really transfer this together and ensure that we have an environment where we can also deliver on many of these promises. But if I then look specifically on the nature and biodiversity perspective, which is very interesting also in the context of the pandemic and what we just are living through here, and it clearly shows that it underlines that society is vulnerable, and that we are obviously completely dependent on healthy biospheres and ecosystems. And there was a report from the Intergovernmental platform on biodiversity and ecosystems last year on the pandemic, and where they were actually saying that the underlying causes of pandemics are the same global environmental changes that drive biodiversity and biodiversity loss and climate change. And one of the areas and the drivers here is land use. And here, of course, we have taken a strong commitment then on life on land, to work on this. And of course, forests are exposed here, but not only from the raw material itself, but also the land it occupies and the people who depend very much on this. So if you go to the next slide, when it comes to forests, as I said, we develop hygiene products in the area, for example, on hand hygiene. And in doing this, we are actually one of the large wood-based fiber users in the world. And we, of course, see that we have an important role to play here together with our suppliers and customers to increase well-being for the planet, but also for the people and the interrelations here. And therefore, we take strong actions, not only because we see the responsibility to do it, but we also depend very much on a healthy forest and a healthy planet. So we have strong targets, not only on the climate emission side of things, but also when it comes to our forest and fiber sourcing. All the fiber that we use has to be responsibly sourced from forestry, and that's why we require all of them to be certified and sustainably certified fibers from FSC or PEFC. And last year we had reached this target by 95%, that all our purchased wood pulp was certified. So we continue to work with our suppliers, we continue to work to improve also the systems to ensure that there are more and more forest owners who can certify their forest, and therefore we can use that sustainable material. But we also work with our peers, with our customers, and in different global forums to actually drive this positive forest action that we are embarking on. And in the Global Consumer Goods Forum, we have launched a Forest Positive Action, Coalition of Action, where actually we together jointly developed roadmaps and guidelines and obligations that we actually publicly now report on to really show under certain KPIs that we're working through the value chain and also on the ground action and improving jurisdictions with policymakers and others to achieve a better situation. On top of that, we of course innovate constantly with our products to ensure that we reduce the use of forest-based fiber, wood-based fibers. For example, approximately half of what we use in our productions are actually recycled fiber, which of course is critical, but also to look at other alternative fibers. For example, wheat straw, we are now starting to produce high quality tissue from, which is of course a rest product from agriculture. So halting biodiversity loss is critical for us because we depend on healthy forests and healthy planets. And of course, that again comes to the link of risk for people in terms of pandemics, and the less species, of course, run the risk of spreading of diseases and infections. At the same time, then, I said we also take action for people. So meeting these risks, we can also do by constantly developing and delivering solutions in the hygiene and health field. So if you take the next slide. Yes, so working therefore on the other side of the sort of the coin, so to speak, working on prevention and promoting well-being is critical here, of course. As I said, it's critical that the importance of basic hygiene has, of course, been very evident for us in preventing disease spread, and sometimes overlooked, but it's also very, very important for ensuring that we deal with those risks that we are facing. So, of course, our contribution here is, of course, to increase access to hygiene and health solutions for all people, and ensuring that these products are safe, of course, for people, and the way they are produced are, of course, also safe for people, and also the environment, of course. So taking an active role here in society. And the way we measure our progress here, because also here we set up targets to ensure that we can deliver also on the preventive side of things. And that is that all our innovations, they have to be yielding some social or otherwise environmental improvements. So improving situations for people. And we measure ourselves to this target and of course, continuously ensure that we deliver on this. So the next slide, which is the concluding slide, I think is very simple. I think we need to look at the broader sustainability agenda, as is the title for this seminar, to really try to meet the different challenges from different perspectives. And from our end, it's looking at the forest and the nature, biodiversity loss, and how that can spill over to pandemics being one of the challenges, but at the same time meeting then, of course, the need from people in terms of prevention and looking at the solutions from that end as well. So I think all these visions are near to be reached, and we just need to continue work together to ensure we reach it very soon. Thank you.
Thank you so much, Anna, and thanks for walking us through some of the examples of how you at Essity make the links also between the two ongoing crises, the climate crisis, as well as the pandemic, and reflecting on how a company is tackling nature and health as well, is in the core of its business. So I'm happy to introduce you to Sally Uren. You are the Chief Executive of Forum for the Future, and we're very pleased to have you here. You have been working on finance and policy advocacy recommendations, and we've been working together with Forum for the Future at the UN Global Compact for some time, and you have some very interesting recommendations to share on how business can actively also engage in at beyond their own corporate internal structures as well on this topic. So I'll hand over to you, Sally.
Thank you, Heidi. Good afternoon, everybody. It's great to be with you here. If we can move to the first slide, please. What I'd like to do today is to share with you some of the recommendations that we've made in this report. I'll post the link to the report in the chat in a moment, but we launched this report just last week at Climate Week, and it is guidance for the private sector, really designed to help everybody in the private sector develop integrated strategies that drive co-benefits for climate and for health. We've known for some time that the climate and health agendas are related. We've known for some time that we can really accelerate progress in dealing with these two big challenges if we started to design innovations with the two issues put together. But we haven't really seen much guidance on how to do that. And so this report is really an evolution of an original partnership that we had with the United Nations Global Compact, where Forum contributed to a UNGC-led report, Healthy People, Healthy Planet, published 2 years ago. So this is a contribution to really, I hope, enable the private sector to ensure that every action that is taken around net zero can also deliver an equivalent health benefit. If we move to the next slide, please. So what we've done in the report, alongside highlight the business case, and we use the lens of air quality, of malaria, and of the food system to really shine a light on these interconnections. And we also talk about the systemic nature of these challenges, but really the heart of the report is the guidance section. And what we've done is made recommendations for all businesses across all sectors. We've specifically focused in on food, on healthcare, building and infrastructure, and finance, which I will come on to, because actually in these sectors there is such benefit to be had from looking at these issues together. But in all of our recommendations, what we've done is to look across all the sphere of influence that a business can have, from direct operations, internal operations, employees, through to products and services, through to supply chain, and through to that really critical wider enabling environment. So for example, if you're a food business, in terms of your internal operations, you can look at reducing greenhouse gas emissions in manufacturing. That has obviously a climate impact, but also has a health impact because it improves air quality. Also, simply by some of the practices that you use in agricultural production, so switching from high nitrogen fertilizers also has a climate impact. A lot of embedded carbon in nitrogen also has a health impact, reduces risk of pollution to watercourses, and so on. So there's a lot that can be done within direct operations, products and services, sticking with food, low carbon diets, clearly a health impact, a climate impact, and then so much that the food industry players can do through their supply chain, encouraging moves to regenerative agriculture, again a health impact, again a climate impact. And then we move through to what all businesses need to be doing when it comes to public policy advocacy, and more of that in a moment. If we move though to specific recommendations for finance, we've picked this out as a specific sector because it's really very clear if we're going to make the rapid and urgent transition to a net zero economy in a way that works for a just transition, I know we'll hear more about the just transition in a moment, then we need to rapidly reallocate capital. And the finance system is such a critical enabler of that transition. And so some of the actions that we're encouraging finance businesses to take when it comes to designing strategies for climate and health are as follows. Applying a climate lens to all assessments, that doesn't happen in a uniform way. And when you're looking at ESG related returns, not just assessing climate impacts, but health impacts. And where are those opportunities, those innovations to allocate capital to new financial instruments, to new technologies that could drive climate and health benefits? So for example, nature-based solutions. If we think about, say, mangrove restoration, if we think about improving soil health, these solutions have obvious climate and health impacts. So how can we channel finance rapidly into those financial instruments? We think that all finance businesses should be advocating for a well-being economy. An economy that's purely predicated on GDP will not deliver the transition to a low-carbon economy as quickly as it should. So how do we broaden out the goals of the economy to include ambitions for low carbon, ambitions for public health outcomes? And then critically, it sounds so simple, but it doesn't happen in a uniform kind of way, is as an asset manager, as a bank, encourage your customers to ask, where is their pension? Is it in funds that are really advocating for a low carbon world? Is it in funds that have a public health benefit? Where is your money? Find out, because there's a lot of money locked up that actually probably could be really harnessed to accelerate this transition. We go to the next slide, please. And this is really a summary of what we really believe the private sector should be calling for from government. So alongside the guidance to the private sector, how when you're developing net zero strategies, you can drive health benefits. We also are very clear at Forum, as I know is the same for UNGC, business needs to find its voice. Business needs to really make it very clear what it needs from government, particularly because we know trillions of dollars are needed to be invested. That capital is there, but businesses will be reluctant to invest that capital if there isn't the right enabling environment, which is really down to the government to put in place to a large extent. So the private sector should be calling on government to work with them. So this is partnership, to shift cultures and behaviours through public awareness campaigns. Governments are neutral. They have a role in shifting norms. Creating the right incentives and finances from public procurement. The amount of dollars invested by local, regional, national, international government are phenomenal. Do we have the public procurement criteria that specifies for every dollar invested, we're driving maximum impact for climate and health? Well, we know that we don't. So how can public procurement become a lever to accelerate this just transition to a net zero world? And tax regimes, subsidies, often these are keeping the current system in play, not allowing the transition to our zero carbon just world. So we really need to find our voice and encourage governments to think about rechanneling subsidies, thinking about getting tax regimes that work for a low carbon and healthy economy, and then enabling policies from urban planning through to how the food system works. And then fundamentally, we need to see new rules and measures that underpin a rewiring of the global economy, including carbon trading. These are just some of the examples of what it is that we need to see that needs to happen from the voice of the private sector into government policy. So quite a list there, quite ambitious, but now is the time for two things: for every business to be designing strategies that drive co-benefits for climate and for health, and for all businesses to be very clear what it needs from government, because the private sector and the public sector working together can really accelerate the transition that we know we need to see. I'll post a link to the report in the chat in a moment, but thank you for your attention.
Thank you very much, Sally. That's very, very helpful. There was a lot of great advice there, and we are getting a lot of questions in the Q&A, and we will soon get into the Q&A part of the session. But before that, I'm very, very pleased that we are joined today by Dr. Maria Neira from WHO. We are very, very happy to have you here today. The work that you lead at the World Health Organization is crucial, and we always look up to the recommendations coming from you. So happy to have you here today and share a little bit more about the work that you're doing on this topic. Over to you.
Thank you very much, Heidi, and apologies to all for this late appearance. I was on a plane and the arrival was a little bit delayed, but I'm so pleased to be with you. And this is exactly one of the favorite topics, because for the global health community, the global public health community, we are always looking for opportunities to further engage on the private sector and how we can all advance on this exciting, healthy transitions, because there are several, the ones that we need to engage on it after, and if we want to recover after COVID-19, and to make sure that in future we will be less vulnerable to other possible crises. One of the transformations that we need to do, and you know that very well, is the healthy energy transition. We need to make sure that we will be moving into a quick and ambitious accelerated agenda on moving into clean, modern and sustainable sources of energy, renewable sources of energy, and stop this combustion of fossil fuels. WHO was launching last week, and I hope you all saw in the media and it's of course in our website and everywhere that we are making more demanding, more strict levels for 6 pollutants that are the ones that are very harmful for our health. If the countries, if the governments could endorse those recommended levels of pollutants, which are now lower than before, we could avoid as much as 80% of the deaths, the 7 million deaths that are occurring every year due to exposure to air pollution. So as you can imagine, this is something on which we will very much like the support, the creativity, the engagement of the private sector, from a technological point of view, from advocacy point of view, on engaging the whole society, because we need to be very ambitious and very quick on this energy transformation and transition. The other one clearly is our cities, and the mobility in our cities needs to change as well. And on that, again, the creativity, the business model, the engagement of the private sector in collaboration with the public sector can help us on ensuring this very much needed healthy transition to a healthy urban planning. Planning the futures that will be the ones that we need for our new society, which will be less vulnerable to new crises. We are very much counting on the COP26 to engage all sectors of the society, policymakers, of course, but I'm sure that the private sector will be able to give a big push as well on their corporate practices and then engagement on achieving those goals. We are going to the COP26 with a report that we call the health argument for climate action. And believe me, all the actions that needs to be taken to reduce gas emissions, to reduce CO2, are actions that are so much connected to public health, are actions that can generate so many public health benefits, in terms of reduction of air pollution and therefore saving millions of healthy years of lives, millions of healthy diets if we invest on a sustainable food system, and we could save billions to the health systems cost that we have now to treat all of those chronic diseases, long-term diseases that are caused by exposure to air pollution. So we have a lot to gain at COP26, and we count on any sectors on this very magic word that we are all using, the multi-sectoriality, the need to engage with the different groups and society to achieve this reduction. Very recently, Greta and the children community are telling us that we are a blah, blah, blah community. So we need to prove then that probably they are right, but we are committed as well to solutions and to action. So for us, if you can help us to do this energy transition as soon as possible, we need to stop using fossil fuels. They are literally killing us. We need to invent or reinvent, create a mobility at the urban level that will serve the needs of everyone at a very reasonable price. We need to reinvent our food systems. And most importantly, you need to help us as well on creating this culture of protecting the environments, protecting the ecosystems, protecting the biodiversity. Somehow in our road as a human and society in the last years, we lost this respect for nature, which is the one that is giving us food, water, and the air we breathe. And we need to recover that and stop polluting everything we touch. So with that, remember, health argument for climate action. We are all winners. We will generate more jobs, better economy, more sustainable future, and of course, a healthier society that will be even more happy, and our mental health will benefit as well. Thank you so much for the opportunity, and sorry again for being late. Over.
Thank you so much, Dr. Nera, for being with us and sharing the work and the priorities of the World Health Organization. Before you have to leave, I could see a very interesting question coming in actually that I wanted to pose to you before we move to our next speaker. And that is, why do you think that public health outcomes are not more heavily emphasized in climate policy and in climate initiatives? What do you think are the barriers for that?
Is the question that I'm asking myself every single morning. I mean, why? We have 7 million premature deaths caused by air pollution. We have enormous benefits that can be obtained. We are talking about wise and non-regret investments, because we are not talking about investments on something sophisticated that you don't have the proof that it'll work. So one reason is probably that the citizens are not yet aware that when we talk about climate change, it's about their lungs. So we need to be very tough on that. We need to make sure that they understand, the normal citizens, they all understand that climate change, air pollution, biodiversity are extremely and closely linked to their health. And I think the moment they will understand that, I think that the passion and the motivation and the pressure on their politicians will be bigger. The second question is that in all the scenarios done under the climate change negotiations, when they did the economic cost for investments, I'm sorry, but they never ever included the health argument. So you can decide how much it will cost you the transition to a decarbonized society, but they never included in that cost the externalities, means the cost for the health system of the diseases caused by the use of fossil fuels, for instance, which will cover totally double the coverage of the investments that you are making to do this decarbonization. At the moment, there are 5.3 trillions in cost for air pollution through our health system globally. So as you can see, it can cover perfectly the cost of any investment. 124 billions on working day loss because of the diseases linked to air pollution. So I think that the arguments are there. But and the third reason, the last one I will tell you, is that maybe until now we have been too much insisting on the environmental part, on the planet, on the polar bears, on the future. And when we talk about health, we talk about immediate children lungs, no next generation, this one, and your own health is affected. So maybe we need to connect a little bit more and depoliticize this agenda in the good sense, because it has to be a very political agenda, because it's for the health, the good of the people. But it has to be depoliticized in the sense that it is not the right wing or the left wing. This is my lungs, my heart, my brain, my body, and my health.
Thank you very much, Dr. Nera, for those words. And we're very happy to have with us today here many companies who are also seeing these connections, and hopefully together across stakeholders, we can make these cases much more clear for our decision makers as well. Thank you so much, Dr. Nera, for joining us. And we'll move to our last speaker. I'm happy to introduce for you Mette Grangard Lund, who is the technical officer at the Green Jobs Program at the International Labour Organization. Mette, over to you, and then we will move into the Q&A.
Thanks a lot for that, Heidi, and good morning, good day, good evening, everyone, depending on where you're calling in from today. As Heidi mentioned, my name is Mette. I work with the Green Jobs Unit in the ILO. The ILO is UN's specialized agency for all things related to the world of work. We are a tripartite organization, meaning that our constituents represent governments, workers, and employers. So my job focuses on how climate change affects the world of work. And amongst other focus areas, I work on the role of business in creating green and decent jobs. specifically supporting a just transition, which I will be talking about today. So my presentation, I will touch upon a few ways that climate change impact business and workers, and thereby profitability and productivity. Second, I will present the ILO framework for tackling climate change. So that's the framework we call a just transition. And lastly, I'll talk about what does a just transition mean for business, and specifically focusing on the health perspective. So let's move on to the next slide. Why and how are business and workers impacted by climate change? So first of all, let's start with business risk. So climate change is directly linked to business risk, and that is clearly seen in the image I brought with me here from the World Economic Forum's Global Risk Perception Survey. So this image shows the likelihood of a certain risk over the various years, over the past 9 years, in fact. And what we can see is that the likelihood of environmental related risks are rising. So much that last year it was the top 5 most likely risks to affect business were environmental. And I think actually really quite timely for today's session, the most likely risks of this year are environmental and health related. I can say that there's a similar image in the report on the impact of those risks, and that trend looks the same, that the impact and severity of environmental risk is increasing and has been doing so for the past 9 years. Next point is business resilience. So resilience is obviously closely linked to tackling these risks that we just had a look at. There's a great report from the ITC focusing on SME competitiveness that found that resilient companies were 5 times less likely to lay off workers and more likely to have stable sales. So I think this is a super strong argument for addressing environmental risks, but also health risks, right? And specifically the nexus that we're talking about today. Next, we have efficiency and productivity. So here, I think that all the previous speakers have talked a bit about some of those health-related risks that there are to climate change. I will flip it around a little bit and look at how, you know, those environmentally related health risks are impacting business. So we can see that, for example, in terms of productivity, the same report that I mentioned from ITC just now found that nearly 60% of African companies found that greening their enterprise led to higher quality products, increased productivity, new markets and lower input costs, and they actually also got better access to finance because of greening their business. Then similarly, when we talk about climate change and the nexus with health, one thing is obviously global warming. So I included a bit of statistics here, looking at how climate change and specifically heat is impacting productivity. And what we see is that by 2030, 2 to 5% of working hours will be too hot to work in. So owing to climate change. This obviously has huge impacts, right? It will mean that people around the world will have to work longer days because they can't work in the middle of the day. This also has gender implications. So what does that mean when you suddenly have to work a much longer day? So, and then something that I think is really interesting is also that one thing is not being able to work at all. Another thing is just the overall lowered productivity that we see with rising temperatures. So, for example, when we get above 33 degrees Celsius, a worker operating at moderate work intensity loses 50% of his or her work capacity. This is obviously huge implications for business, no? So let's move on to the next slide and move into the just transition agenda that we work with here at the ILO. So Dr. Nera mentioned that when we talk about climate change, we talk about people's lungs. And this is definitely true, but as I just talked about now, the issue in this nexus is much wider than that. And that's really what the Just Transition guidelines are trying to address. So with the Just Transition guidelines, we're looking at climate change from a whole of society approach, and how we have to address the problem from various policy areas, right? So what we see here on my slide is that we know that from a green transition, let's focus on energy for a moment, even though Just Transition is much broader than just energy. We know that a green transition can lead to new jobs. In fact, there will be created 25 million jobs out of green transition. But we also know that we will lose some jobs. Clearly, there will be some people who are going to lose their job from an energy transition. In fact, 7 million people globally. So that still leads to a net job increase, right? But we have to have a plan for the people who will lose their jobs. Otherwise, we will end up with extremely unstable situations. And in the end, it won't be a very fair transition, and it's going to be an extremely unequal future that we're heading towards. And that's basically what the Just Transition is trying to address now. So we can see on one hand, by planning for Just Transition, we will have maximizing our climate action, our climate ambition, while minimizing the potential social harm that there will be in such a situation. So I'm a little bit short on time, so I will quickly move on to the next slide, which is how I had tried to organize the Just Transition. So what you can see is, in fact, the Just Transition guidelines, which is a document you can find on our website, was decided on by our tripartite constituents. So it applies to both governments, workers, and employers. It has 9 policy areas, but I tried to group them in this way. In my presentation today, I'll focus specifically on the occupational safety and health element of it. But I think also, as we have talked about today, in general, you know, there are broad areas that we need, the companies and workers and government need to work on, and I think my slide here shows that pretty well. So in terms of occupational health and safety, what can businesses do? So they can, first of all, make concrete plans for climate action and net zero commitments by mid-century, the latest. But then, of course, they should also plan for Just Transition. So they need to review those climate action plans with these different policy areas in mind, and one of them is occupational safety and health. And the reason why this is here is, again, keep in mind that that heat that we will all be working under. So obviously businesses need to follow the legislation and policies of where they're operating. They need to promote occupational safety and health training, conduct assessments and increased or new OSH risks resulting from climate change. Then the next step would be to improve, adapt, and implement those OSH practices based on that assessment. So all these are sort of outputs or things that you could work towards. And in the ILO, we are really promoting the methodology of social dialogue. So the last recommendation would be to establish an OSH committee with workers and employers in the workplace. So that you can both plan for the climate change and the health risks that are coming towards your business. The last thing I wanted to include is just this little image. I hope you can see it, but it really captures those labor standards and some of the guidelines that we have at the ILO that are relevant to when we talk about climate change and health. And if you want to know more, take a look at the ILO Just Transition Guidelines, but also the report from 2019, which is called Working on a Warmer Planet, which really talks about the impact of global warming on productivity, efficiency, but most importantly on people and workers and business. Thanks for your time and thanks for your attention.
Thank you so much, Mette. It's great to also hear how, from a social perspective, the ILO is working on this topic. And we're very happy to have had so many different angles coming to the topic of making the co-benefit connection between climate and health. We are running a little bit late. We are getting a lot of really great questions for our speakers. And I wanted to see if we could just have 2 quick questions for our 2 corporate speakers before we wrap up. So let me start with a question to Anna at Essity. There is a question coming in around environmental and social targets. So what are those targets that you have made at Essity, and how are those being measured at your company?
Well, thank you. That's a great question, of course. And in the short term, I had to present, I couldn't go through all of that, but I mentioned 2 or 3 of them anyway, which was the commitment to reach net zero greenhouse gas emission at the latest by 2050, and also that we signed on to the Science-Based Targets initiative, where we have commitments to reach those targets by 2030, and that's all the 3 scopes of the science-based targets, and that's 2 quite large sort of commitment on the environmental side. But then I also mentioned us being quite a large purchaser of wood-based fiber. We of course have also responsible sourcing targets here, where we have this very clear commitment on fiber sourcing. But actually we look at responsible sourcing overall. So we have set up sort of specific supplier standards that we measure our suppliers towards, which actually compiles different other elements also, including human rights and also other sort of measurements and certifications that we obey to. And that's maybe more on the environmental side then. We of course also have measurements on water, not to forget about that, having talked about biodiversity. But also on the social side, as I mentioned, sustainable innovations, they are measured both on the environment deliveries, but also on how does it deliver on social values to people, of course. And then of course occupational safety, human rights I mentioned, and also of course on measures like business ethic and gender equality. So I would say we have quite a large spectrum of different both environmental targets and also the social targets, and it goes hand in hand with our commitment to the sustainable development goals, that we really commit to both the people and improving hygiene and health, and at the same time ensure that the environment and climate objectives are also met whilst doing this. And it's so interrelated, and that's why we measure. And the way we report on that is of course yearly in our own annual and sustainable reporting procedures, but we also report via Ellen MacArthur, for example, where we are committing to plastic targets, which I didn't mention, and also to many of the other platforms that we are part of. So through our own channels, but also to third-party independent channels. A long but short tried answer, I think. Thanks for a good question.
Thank you, Anna. It's very clear that that these questions need to be tackled on a very broad scale, and thanks for mentioning a few of those, and also the importance of having of being part of these greater of these overarching initiatives run by other organizations. So you just not only do kind of self-verified targets, but actually put them out there in the public and to be verified. It helps the credibility of what the company does.
Exactly.
Thank you. Thank you. Jason, over to you. There's a lot of questions coming in to you, and we're running a bit over time. And thanks for also being part of the chat there. I wanted to see with you, I mean, you are a health company to start off with, so probably for you, it was fairly straightforward to make those connections between climate and health. But could you tell us a little bit more about what do you see is that business case? You know, Dr. Nera also spoke about the fact that maybe it isn't so clear for everyone. We've been working in a lot of silos on these questions, and how you internally with your employees as well as with the company as such, how do you make the case of working with these complex topics and making the connections between them?
I think for us, we've always had that sustainable mindset because we're an innovation-based pharmaceutical company. So we're not in the generics or the over-the-counter business. So in essence, we have to predict the landscape of care and meet unmet kind of clinical needs kind of 10 or 15 years out. So you're always thinking ahead in terms of what that healthcare landscape is going to be, what the challenges we're going to face as society and economies going ahead. And increasingly what you see are kind of the environmental trends actually impacting not just healthcare, but also the way in which we're going to have to do business in the future as well. So for us, yes, we've embraced our net zero targets. They've been verified by the Science Based Targets Initiative. They're extremely aggressive, as I talked to earlier on, but we're only one actor within that healthcare landscape. So it's trying to bring everyone else with us and say, well, yes, we can take our healthcare infrastructure to net zero without changing what we're doing, but actually we need a step change. We need to revisit how we interact with patients, the point of care, and actually do that in a much more sustainable manner. As a society, we can't wait for people to get ill. So actually we have to look at disease prevention strategies, and we partner globally with YHP, so the Young Health Programme, working with adolescents to actually make those healthy lifestyle choices earlier on, so actually they don't become patients actually in the longer term. So for us, it's about long-term thinking. It's about integrating environmental considerations alongside healthcare considerations, looking at the role that we can bring, but actually also challenging others across the sector, whether or not they're our suppliers or whether or not they're our patients or the people providing medicines to our patients, to say, well, how can we do things differently? How can we do things better, where there's a win for patients, a win for community, a win for the economy, but actually also a win for the environment. And there will be opportunities for our business within that model, but actually there would be areas potentially that we're going to lose out. But I think the way the planet's going, there will be more opportunities for us than losses that come through. And then it's looking at the impacts of climate change on our business. So they're our own sites, our supplier sites, and it's building climate resilience in. So we double source things at the moment to manage risk and to ensure patients can access medicines, but it's factoring in the different climatic scenarios that are coming through to say, well, actually, is the provision of goods going to be impacted by climate change? Are our staff going to be impacted? So we heard in the presentation there about the occupational kind of threats. So it's looking to say, well, where are we going to have excessive heat? Where are we going to have that combined with high humidity across our sites and networks, and build that resilience in now? Where is that high heat actually going to compromise things like good manufacturing practice and the production of our medicine? So it's building in actually the capital investments now to control those temperatures. So yes, climate, health, the planet, economies are all interacted, but it's not about thinking 1 year, 2 years ahead. We've got to think 5, 10, 15, 20 years ahead now. And that's not just for us, but it's taking our suppliers and broader value chain on that journey.
Thank you so much, Jason, for sharing that. And, you know, you've heard a few examples, and we can move to the next slide where we really also cover some of the takeaways and the resources that are available for all of you who wants to look at more into how you can get engaged. So from the Global Compact side, you know, we highly recommend you to take a look at this brief that we've come out with. You know, for example, we heard about setting your science-based target. There's a lot of co-benefits there. You can also join other initiatives such as the Climate and Clean Air Coalition, which work on short pollutants, for instance. There's the Science Based Targets Network, which is currently delivering on putting forward methods on how companies can set nature targets aligned with science, for instance, on water, which was one of the topics that came out, on land use, on ocean. So all of this is coming up. So we really encourage everyone to keep an eye open for more of those resources coming. And then we also encourage you all to stay tuned at the UN Global Compact. We will be working more on the just transition piece together with partners such as ILO in next year. And we also want to welcome you to future Academy sessions. On the climate side, there will be another climate cross-cutting issue that we will cover in October, and it is on climate and gender. So we welcome you all to join that one, and looking forward to continue this very lively and discussion. And thank you to all our speakers. Thank you for the audience for staying along, and thank you for the team for organizing this session. Have a great rest of the day. Bye-bye.